Namaskar. This is Dr. Roy again here. Like every week, every Saturday, we meet you on a banner of Medica Hospital where health is the ultimate wealth. This webinar we conduct every week on Saturday between 5:30 to 6:30. We bring a lot of topics to you. We bring a lot of small healthcare tips which helps you in staying healthy. There's no point in treating you when you come to the hospital. What is required that if you can stay healthy at home, so you don't need us if possible. But that is not the way. Very recently, we had a tragedy in Calcutta. We lost one of our a good singer in Calcutta. His name was KK. All of you are aware of him. And you know he died while performing live in Calcutta in the Zul Manch. Now, what went wrong? What really happened? And we take life for granted. We think that we can do anything we want, but there are limitations to what we can do, what we cannot do. And how do we realize it? What are the signs and symptoms? What are the warning signs? At what age, what we can do, at what age we cannot do. So I have with me two experts. I have with me Dr. Dilip Kumar. He's our senior consultant and director of Cath Lab, Interventional Cardiologist, pride of Calcutta and pride of Eastern India, Dr. Dilip Kumar. And I have with me Dr. Aviral Roy. He's a senior consultant in critical care. I've got these two experts to throw light on that what happened to KK and can we prevent it? This happens to us every day. We as a specialist see it every day and my colleagues see it far more. We lose a lot of young lives just because of small things which could have been prevented or avoided. With this short introduction, I'll request Dr. Aviral Roy to tell us what are do's and don'ts in our lives, what are signs, symptoms, and what are the signs, symptoms to watch for, and what really happened. And then we'll go over to Dr. Dilip Kumar to give his expert opinion that what really went wrong with KK and how to prevent it with all of us. We can't bring KK back, but we can prevent it happening with you all. With this, I pass it all to Dr. Aviral Roy to start his presentation.
Thank you, Dr. Roy. Thank you, everyone. Just give me 2 seconds. I'm just going to upload my slide. Can everyone see the slides?
Yes, we can.
Excellent. Okay. Good evening, everyone, to another episode of Health is the Ultimate Wealth. So, unfortunately, we all heard about what happened to KK. So, we're just going to discuss a quick discussion of the events, the setup or the lead up to the event surrounding what happened. And I'm going to talk a little bit on, common symptoms that we all have, common maladies that we all have that are often very, very non-specific symptoms, but how to recognize or how to identify danger signs among them so that, you can come to the hospital early, but at the same time, not coming to the hospital for every single time you have a cough or, gastritis or headache. So we're just going to understand what danger symptoms are or danger signs are, how to recognize them, and when to come to the hospital. So what is the setup? We had a 52-year-old male who was supposed to set up a concert in Calcutta, approximately 35-degree heat on that day, with about 85-86% humidity. The person's also supposedly been having severe heartburn the entire day and has been having multiple tablets of antacids, that is some drugs like Gelusil or Eno. He's been feeling also unwell the entire day, very, very non-specific symptoms, some weakness, some tiredness, but not really any difficulty breathing. And he thinks he's fit enough to go for the concert or perform at the concert. Allegedly, the concert hall was overcrowded It has a capacity about 2,500, and that date apparently had 6,000, 7,000 crowd. The ACs may not have been functioning as well because of the crowd, because, right, let's face it, human beings release a lot of heat. And if you're designed only for 2,500 people and if 3 times that number, it's not going to work. Also, the windows and doors may have been open to help accommodate the ventilation for so many people. So you would have lost a lot of heat and a lot of cold air and heat in that. During the performance, the singer had asked multiple times for the stage lights, which have a big heating effect, to be removed from him, and had asked the air conditioning to be turned on, even though it was already on. This is what we know. This is what we think happened. And Dr. Dilip Kumar is over here, will be talking much more in depth and giving a better understanding to what we think happened. Patient probably had what is called an evolving myocardial infarction, that is a heart attack, or angina, that is chest pain, that probably began earlier in the day, probably early in the morning when he woke up. And now a lot of us, when we wake up, we have a little bit of acidity, a bit of gastritis, thoda dakar aata hai. So he started taking antacids, but apparently these were not helpful, and these will understand why as we go on over here. He went through the day and decided to go through the performance. The high heat, the humidity, and the energy of the concert puts a very, very high workload. Remember, you're singing, you're breathing hard, you're sweating, you're heavily sweating. You know, your body, there's a lot of adrenaline, and this all puts a lot of effort, puts a lot of stress on the heart, which is possibly not getting enough blood to begin with. As the concert goes on, patient starts getting more and more symptomatic, that he has tiredness, feeling very hot, feeling the heat, dizziness, and eventual just inability to continue anymore. KK normally does a 30-song routine. This day he had to cut it short because he's just unable to sing anymore. But this is actually where the problem begins, or the beginning of the end, as we say. As the concert ends, the adrenaline rush and the energy that was, it's like drugs that are keeping the heart going, they start to go away now. And then the true extent of the heart damage becomes apparent. And this is what we hear. The patient goes to the hotel room, he goes back in the car, he's not feeling well, he's feeling lightheaded, he's feeling weak, he's feeling cold. Why is he feeling cold? Probably because of hypotension, the blood pressure is low, you're not getting blood to the tips of your hands and to your feet. So start feeling cold, and your blood vessels start to vasoconstrict. That means it tries to keep the blood going to the heart, to the lungs, to the brain, and stops the blood going to the hand, to the skin. So you start feeling cold. This is all now without being immediately hospitalized. This is probably a very, very bad place to be in. And that is unfortunately what happens. He's in the hotel room. He apparently collapses in the hotel room. They immediately shift him, but it was too late at that point. The suspicion was sudden cardiac death, which is what was also confirmed at the autopsy later on, that he had a large amount of, what's called atherosclerosis or fatty tissue in the heart. So that's most probably indicative of a heart attack, that a sudden massive heart attack, what we call sudden cardiac death. Dr. Dilip Kumar will share a little bit more on these. What I'm going to talk about are danger signs of common symptoms. Many diseases cause symptoms that are very non-specific, right? You can get a tumor that gives you a headache. You can get a tumor in the stomach that gives you, well, you don't feel like eating. You just feel early. You get early fullness, what you call early satiety. You could have a heart attack that gives you symptoms that feel like gastritis. You could have heart failure that presents as asthma, or maybe a little bit of difficulty breathing. There are certain cancers that can cause constipation. Constipation sometimes can lead to bleeding from the colon. So, we are here to identify these common symptoms that have danger signs. We'll give you some quick tips on how to recognize these and to get a quick diagnosis from your doctor, okay? We'll get started immediately with fever. One of the most common signs and symptoms associated with infections and non-infectious conditions. How do you know if a fever is dangerous? That means the patient is at high risk of developing complications, right? A fever of 104 I'm not talking about fever of 104 that happens for 10 minutes and goes away. I'm talking about a consistently high persistent fever more than 104, especially in adults. Because as children, we have very strong immune systems and our ability to handle temperature is very good. Adults don't handle temperature that well. So especially in adult, somebody who has a fever, who has drowsiness, difficulty waking up, slurred speech with the fever, confusion, disorientation, the fever that does not go down with paracetamol, ibuprofen, and other commonly used medicines at home. Fever that causes severe weakness. They're so tired, they're not able to get out of bed, they're severely weak. And anytime you have a fever that does, you start getting dark urine, that despite you taking more and more electrol, more and more fluids, it's just not getting better. These are all signs and symptoms that you should be going to a hospital. Why? These are all signs of severe fever causing multi-organ failure, severe infections starting to cause dementia, delirium, or acute kidney disease, or acute kidney damage. So these are signs, and or maybe even a bad infection like a meningitis. So these are things that you should quickly, or a bad malaria or a dengue fever even, get to a hospital, get evaluated, or not even a hospital, get to your doctor immediately, get evaluated immediately. If need be, if they say go to the hospital, go to the hospital. Okay. Headaches, one of the most common symptoms we all have. Everybody has a headache. It could be stress, it could be a children screaming and yelling all day long, you could have cough, you could have cold, you could have a lot of extra work, and some people even have migraines. So when does a headache become a danger sign, right? So number one, what you call a thunderclap headache or a sudden headache. So what does that mean? The headache comes on very suddenly and it's very, very severe. Many, many times it's only present on one side, but often on both sides. Headaches that start causing blur, watering of the eyes, blurry vision, difficulty with seeing, what is called chemosis or redness of the eyes should be immediately taken up. Sometimes you have persistent headache in the morning when you wake up, not walking up from sleep, waking up from sleep. And this happens bar, and despite you taking medications, they don't get better. This is a sign that you must definitely go see your doctor. Headaches that are associated with weakness, numbness, tingling are very, very important. And any headache where you're having severe nausea, vomiting, you're losing fluids, you're trying to take more fluids, you're trying to take medicine, every time you do that, you're just vomiting it out. These are all signs and symptoms of what could be called as a raised ICP, intracranial pressure. So that is a danger signal that something is very wrong and you should immediately go see a doctor or go to a hospital emergency room to get evaluated as to what is going on. Next one, shortness of breath. You might say, oh doc, you know what? Everybody knows shortness of breath is a common symptom. And we all go to the hospital when you're short of breath. I'm going to talk about how to differentiate between, a lot of people exercise and they say, oh, I'm short of breath when I exercise. But what is actual shortness of breath while exercising, and what is, abnormal shortness of breath? So shortness of breath that is sudden in onset or at rest, meaning you're doing something that you do on an everyday basis. You're walking in the mall, you're out at a party, you're with friends, and you get sudden shortness of breath. It may even be mild. You must just, sometimes people just know, other people tell them, why are you breathing so hard? They may not even recognize it themselves. If you get short of breath with more than 1 or 2 flights of stairs or walking less than 500 meters, what do you mean by shortness of breath over here? You need to stop whatever you're doing and you need to take a deep breath. You need to sit down. That is what I mean. Shortness of breath that gets worse when you're lying down or when you're sleeping. If shortness of breath you get and you start getting swelling of the legs, you get short of breath when eating food, you start having shortness of breath or heaviness in the chest or vice versa, and you start getting this cough every time you get short of breath, and the cough is repeated. It only happens when you're short of breath. These are all danger signals. It could be evidence of a heart problem where you are having fluid building up in the heart, or evidence of some sort of heart failure. It could be evidence of blood clots in your lungs that could not be allowing blood to flow effectively. Or it could also be evidence of something like a tumor in your lungs, which is blocking off a major airway, right? Or trying to compress a major airway. So in that case, all of this would require evaluation either by a doctor or an emergency room. Blood pressure. A lot of us have blood pressure. A lot of us have family members who have blood pressure. When do you go to the hospital with blood pressure, right? Or to the doctor immediately? Any pressure that is more than 180 by 110, even after taking medication. This is important. If somebody is not taking their medication, the pressure is high, the first thing you do is give them their medication. If despite them being on their regular medications, you're still having high blood pressure, you should take them to the hospital immediately. Any elevated blood pressure with chest pain and shortness of breath, blood pressure, high blood pressure and headache, blood pressure with decreased urine output, blood pressure that starts causing pain that goes to the back. It could be in the lower back, it could be in the upper back, it could be between the shoulders. Immediately go to the hospital. And anytime you get a high blood pressure and the patient starts saying, I'm having weakness and having numbness, tingling, or my muscles don't feel right, or something does not feel right, blurry vision, decreased vision, double vision, what's called diplopia, immediately go to the hospital. Okay, let's come to what actually, what we just discussed in the beginning of the lecture, acidity. Acidity is very, very common in Bengal, but there are certain things which are features of heart attacks or cancer that has to be taken very seriously. Persistent acidity does not respond to antacids, that's Gelusil, Eno, many other brands I won't get into, but these are the two big ones. This means that acidity should respond immediately to one tablet of Pudinhara or Gelusil or Eno, right? You get a little bit, you take that, immediately you feel a little cold, you might have a little bit of burping and you feel better. That is acidity. If you're continuously taking tablets and the acidity is not getting better, then it's not acidity, it's something else acting like acidity. Every time you get acidity that worsens when you're walking upstairs or climbing stairs or exerting yourself. Okay, this could be evidence that one of the valves in your esophagus is not working properly, and every time you have to pull your stomach in or do any exertion, you push acid into your throat. Difficulty with swallowing, this could be evidence that your esophagus muscles are not working in coordination. Your food pipe muscles, esophagus. Hoarseness of voice is likely when you have a lot of acidity that keeps coming up. In fact, it starts burning your throat and starts burning your voice box. If not taken care of early, can lead to voice loss. If you have difficulty sleeping and snoring because of acidity, remember, these result in high blood pressure. Snoring causes lack of sleep. You could doze off while doing important things like driving. So if your acidity is interfering with your sleep, definitely needs to be checked out. And if you notice that acidity is causing decreased food intake, or you're stopping your food because you're having persistent acidity, it needs to be checked immediately. It could be evidence of a type of tumor that secretes acid. Actually, the treatment is very, very easy, very, very straightforward, but certain tumors will secrete acid. So and the treatment is they just stop eating so that there's no need for acid anymore, because one of the stimulants of acid in the stomach is food. So we see this very, very commonly. And acidity is in fact the most common thing that we get. People come to the hospital, even for cardiologists. A lot of time, a lot of cardiac diseases. In fact, some of my own close family friends, they had acidity and turned out to have a big heart attack, and they needed to get angioplasty, and some of them have heart failure, in fact, that started out as acidity. Stomach pain. Let's face it, this is India. Everybody gets gastroenteritis and other diseases. Sabko puchka acha lagta hai, sabko bhel puri acha lagta hai. And you're going to get acidity. You're going to get gastritis, you're going to get stomach pain. And these often get better. But when is it urgent? When you get sudden pain, that is worse with pressing or touching. Remember, gastritis should not ache if somebody comes and presses your stomach and presses it inside. Gastritis is inflammation of the intestine, a little bit of inflammation, but This sudden pain or that gets worse with touching or pressing is what's called guarding or rigidity. It means that you're having severe inflammation of your stomach, that now the muscles are tightening up and preventing anything from moving. This is a sign of something like appendicitis or gallbladder, cholecystitis, what's called inflammation of gallbladder. Need urgent evaluation, otherwise can cause perforation and may need surgery. Anytime having severe stomach pain and nausea, vomiting, unable to take fluids, this leads to dehydration and can lead to kidney disease or kidney failure. Radiation to the back, very, very important. Pancreatitis is a common issue with people with high triglycerides, high cholesterol, who smoke a lot, who drink a lot, and often with gallstones. This can cause a severe inflammation that will cause you to be in the ICU for weeks, not days, for weeks. Any distension of the stomach, because then you can have a stomach, I mean the entire abdomen. So if your abdomen is getting distended, you're not having bowel movements, you're not farting, it means the intestine is not moving, it could be obstructed, you need to see a doctor immediately. Any darkening of the urine, not better with fluids, this is indicative of kidney disease, kidney failure. You need to see a doctor, you need IV fluids. Severe weakness, drowsiness, and fatigue means whatever is happening is now starting to affect your brain and your muscles. So you need to see a doctor straight away. And finally, weight loss and appetite. A lot of us are told that we're all overweight. A lot of us are told we need to exercise and lose weight. So why weight loss, a bad thing? Weight loss is bad for you when it is unintentional weight loss with a normal appetite. It means you're eating normally, your appetite has not changed, but you're still losing weight. This could be evidence that your body is, utilizing far more energy than you're giving it, or is not even bothering with the energy and has gone into what's called catabolic state. That means it's breaking itself down. Stomach pain with food. What does this mean? If despite you're eating and you're having severe stomach pain and that's why you're losing appetite and you're losing weight, this could be evidence of severe gastritis and can cause medical issues. You need to see a doctor. If you lose more than 10% of your weight in 6 months, is a danger signal. Unintentional weight loss, of course, if you're trying to lose weight, this is great. But if it is unintentional weight loss, then it means that you should be evaluated. Could be chronic infections, TB, could also possibly be cancer. Loss of weight and loss of appetite and otherwise normal person, young teenagers, you might have heard of diseases like anorexia and bulimia, where they avoid eating, they don't want to eat. This could be indicator of severe psychological and psychiatric conditions and need immediate counseling and guidance. Otherwise, it can cause very, very severe long-term problems. And anytime you are having weight loss that's associated with decreasing blood pressure, decreasing heart rate, severe weakness, you should immediately seek help, because these are all signs of heart failure or multi-organ failure about to set in. So that's when you should seek a doctor immediately. My final topic, back pain. When is back pain bad? Everybody gets back pain, right? Back pain is bad when it's not musculoskeletal anymore, means you start developing neurological symptoms. That is shooting pain down the hands and legs, sudden weakness, decreasing strength of the hands and legs, numbness, tingling, sudden uncontrolled muscle movements with back pain. Pain in the back is usually on the sides, on either side of the spine, not in the spine. But if you get pain in the spine or while pressing on the spine, that is bad. And any bulging on the back or irregularities that are new could be signs of infection or abscesses in the back that is trying to get bigger and are causing worsening back pain. Urination. This is important because what happens is a lot of people have prostate issues. And what happens is they go in the middle of the night and most commonly they fall and break a hip, or they fall and they hurt their head, or they fall and they have an intracranial hemorrhage. So urination, when you have trouble starting or stopping urination, trouble holding your urine, if you have redness in the urine, especially in males, could be signs of infection or severe infection or cancer. Repeated urinary tract infection in females, anytime any male has a urinary tract infection. And like we said, having to wake up repeatedly at night or having to go to the bathroom every 2 to 3 hours to urinate. I think I'm almost done. I have 2 more slides. Stool,
So this is the
thin
last slide.
stools. Yeah, this is my last slide. Stool, thin stools with repeated constipation could be evidence of obstruction in the colon or the large intestine, could be cancer. If you're only having stools every 3 or 4 days, you might need some medications, because remember, if you're too constipated, you get disease like diverticulosis and diverticulitis, which cause bleeding, severe infections, and cause a headache later on. Every time you're having difficulty with going to the bathroom, having swelling and distension of the stomach, I mean the entire stomach, the whole abdomen, could be evidence that you're obstructed or blocked. Any red color change, any pus in your stool could be evidence of severe infections. Painless red color bleeding could be evidence of what is called diverticulosis, that is bleed or hemorrhoids. It could be painful, could be painless. You should get a screening colonoscopy every 10 years if you have a low fiber diet, or if you live abroad, if you live abroad or have exposure to Western diets, you have a higher risk of colon cancer. And finally, leakage of stool during normal activities is abnormal, should not happen, is more of a discomfort, and most people would anyway seek a doctor's advice if this were to happen. Thank you so much. I will hand over the mic to Dr. Dilip Kumar.
Before Dilip starts, so we just asked Dr. Roy to cover what are the usual day-to-day problems which we take for granted. We think that we have nothing wrong. So he just kind of gave you an overall summary of usual problems which you should be aware of. And he also told you that if it extends to, like he said, antacid, if the antacids are not working, there's something seriously wrong. If your acidity is increasing with climbing stairs, something is wrong. If shortness of breath is so much that you have to stop, something is wrong. These are the warning signs. And with this, we go over Dr. Dilip Kumar, who will tell us that in a background of what Dr. Aviral Roy has just explained, he will tell you really what happened and what could have been done to save him. Dr. Kumar, I'll also request you to tell us that how do we ensure that our youngsters, when I say those who are in the most formative age of their life, can continue living rather than dying so helplessly?
So, yeah, thank you, sir. I think Aviral has covered a lot of important aspects, emergency situations where patient should be cautious, feel cautious about. And it is really very hurtful if someone like KK or anyone young person who is asset for the society, asset for the family, asset for the country dies so young. And it was more hurtful because it happened so close to hospitals. There were 3-4 hospitals which was very near to the place he was doing concerts. And these are not unknown and unheard of incidences. So it's time and again we are, get to see this. There was a huge, noise came when Cristiano Jr. died due to sudden cardiac arrest in the year 2004 during a football match, and he was playing for East Bengal. And recently a young cricketer died, and I will show you, it is a little scary, but I think it must be shown so that people can take a note. You can appreciate this this young player who is at the runners-up crease. You see he is now sitting down, he's not feeling well. And you see now he drops. So this is, and he was, he couldn't be rescued, and we lost this young player. It happened in Pune 6 years back. So these are nothing new. We see these things every now and then, in 3 months, 6 months, such incidents as bad, which could be prevented, comes up, and we really feel so bad about it. So what we all deal with in this scenario is a sudden cardiac death. So these incidences are nothing else but sudden cardiac death. And the etiology, I will show you 3-4 slides, not much, so that we can discuss. So SCD refers to an unexpected sudden death from cardiovascular cause in a person with or without pre-existing heart disease. Death occurring within 1 hour of an acute change of clinical status. Suppose a person who had 3-4 days some symptoms, he is now doing well. All of a sudden he develops some symptoms and he dies within 1 hour of that, new onset symptom. This is called sudden cardiac death, because in 99% of the scenario, heart is the culprit. And these are basically the reasons. Etiologies of sudden cardiac death. 80% time it is underlying coronary artery disease. What we got to see in our beloved KK's case, there was a disease in the LAD, and one more vessel there was blocked, and 70-80% disease there, and then there is a thrombus formation happens and a heart attack happens, and the patient collapse. 10 to 15% cases, there's a cardiomyopathy, and 5 to 10% long QT syndrome, Brugada. These are familial genetic syndromes where there is a sudden abnormal heart rhythm. It goes into ventricular tachycardia, ventricular fibrillation, and we lose patients. So majority of the cause is coronary artery disease. And these are a global data in Indian, some Indian perspective. 17.3 million, it's not a very, very small number. 17.3 million deaths are happening globally per year because of the sudden cardiac death. And India is not immune to that. We have around 10.3% of overall mortality is because of sudden cardiac death. So huge chunk of death is happening because of SCD. And if we know about these problems, we can, take some sort of precaution, or maybe if something happens to us or someone in the near vicinity, we can start working on that. The first thing, when you see a person dropping down, he is not breathing, alarm situation, raise an alarm, dial nearest hospital, ask for an ambulance, and you start chest compression. This has shown to increase the survival by 200%. So a person, odds of survival, the patient comes to hospital when he had received by a CPR by a bystander, anyone, not a qualified doctor, not a qualified nurse, anyone, a bystander, if he starts compressing the chest at rate of 100-120 per minute, the chance of survival of that gentleman who has dropped down is 200%. Twice, in a situation where he was not given any CPR. And these are basically non-coronary causes of sudden cardiac death. I will not go into detail, but there are some cardiomyopathies where heart has become abnormally thick, or there are some arrhythmogenic right ventricular dysplasia, or something like CPVT, some channelopathies, so which are very rare. And in these scenarios, what I am showing the list of the diseases, this will give a very bad family history. So someone who has a bad family history means sudden death happening in father, mother, or any siblings in a younger age, or grandparents, he should be screened for these problems. And coronary artery disease, obviously, he will have some family history, and then on top of that, there will be some risk factors like diabetes, hypertension, smoking, which we can discuss. And finally, last slide, I will show you how the death happens. When heart attack happens, all of a sudden patient dies. It's all because of the transient arrhythmias, which is 100% treatable. Suppose KK had a heart attack, starting of heart attack on Monday, and in Tuesday he collapsed. It means he had some arrhythmia there. We'll talk about that. And there is also, I will show my last slide, something about devices. If someone has a bad family history, and an ECG shows ventricular tachycardia, he's dropping down, he's fainting, then these devices are life-saving. So this is not the, it is beyond the scope of today's topic, today's talk. I will stop sharing my slide, and I will briefly tell about why KK died. It was all because transient arrhythmias which can happen. And if a person is wheeled to hospital, these arrhythmias are 100% treatable. Suppose the patient has a blockage in right coronary artery, he will have transient bradycardia. So a simple atropine will revive him. If a patient has a LAD blockage, and then he can have a VT, which can be shocked, and patient rhythm reverts, and he will be 100% saved. So these are 100% preventable deaths which is happening within 1 or 2 days of chest pain. If someone delays and time is something like 3 days, 4 days, in these situations, heart muscle gets damaged, and there the revival is difficult. So the bottom line is, time is muscle. We have to appreciate something going wrong. You feel you are not feeling good. Symptoms, Dr. Aviral has very, very, brilliantly elaborated what kind of heartburn, which is not, subsiding with antacids, it's worsening on movement. If this is happening to you, you are sweating, everyone is comfortable, you are only uncomfortable in a hall. If you are feeling a pain who is going up in the left arm, it's not getting relieved, must seek doctor's opinion. A simple ECG will tell you how to treat, and your life is safe. So, thank you, sir. I think we can discuss on important aspects.
Thank you, Dr. Dilip. Dr. Dilip, what is most important at this point of time in our mind, that probably, as you have explained, that Mr. KK had MI, and it was continuing for last 1 day or 2 days, and suddenly, as you have said, he had an irregular heart rate, and which probably killed him. Am I right?
Correct, 100%.
So this is in a case of person whom earlier there was no diagnosis established, there is a heart problem. So what are you saying, that if you have a consistent acidity which is not improving with the medicine, shortness of breath, or you are feeling weak or sweating and all that, so he must get an ECG done? That's what you're saying?
Right, sir.
And
like
see a
ECG,
doctor.
yeah, if something is happening at rest, if pain is happening when he's sprinting or he's moving for more than 500 meters, 1 kilometer, then this is angina. It's not that emergency. You can see doctor next day also. But if something is happening at rest, so you are comfortable sitting at your home, having a cup of coffee, and you feel discomfort, and you take a antacid, it's not getting relieved, and when you start walking, it worsening. This is very bad. Rest angina, rest discomfort, which is coming from heart, is 100% a sign of heart attack.
So in case of KK, he had, of course, symptomatically he was appearing distressed, which everybody thought could be a heat, but it was underlying a cardiac problem, which was, and he was singing, but it was very hot, but he was not running or anything. He was just walking around in a stage. So that was something which is a kind of probably triggered arrhythmia. Now tell me that, so all those who are above 35 must get a regular checkup done. Is it a good statement to make?
Absolutely, sir. Absolutely. So 35, 40 years is basically a norm, but someone who has a history, bad family history, whose parents had died earlier in 40s and 50s with coronary problem, they should start screening even at 30 years. I can suggest some 25 years even, because we see MI patients even at 20 years, 18 years also. So 25, 30 years for those who have very bad family history, and 35 to 40 years, as you suggested, for a normal person who doesn't feel that he would be having a cardiac disease.
So the earlier you start, in case if there's a family history, you can start later, 35, 40, if you don't have family history, but as a routinely health checkup once in a month, where treadmill and echo is very important, integral part of the test. Is that okay? Statement to make?
Yes. Correct.
Now, you also said about AICD, that but AICD you only implant where you have diagnosed the case. Like Dr. Dilip Kumar said, that if you have a right coronary artery disease, then you have a bradycardia. What he meant was slow heart rate, where heart rate become very slow, which is not compatible with life. So you can give an atropine, which can increase the heart rate. When he said the left side, you get a VT, means ventricular tachycardia, means your ventricle beats very fast. So for that, he said we can give something else to control it. So, but you said AICD. What is AICD and what is its role in preventing sudden death?
So AICD is a machine which can deliver shocks. So we all have seen in different movies, in Hollywood movies, even in Indian movies like Jab Tak Hai Jaan, Shah Rukh Khan was given a shock. So shock everybody knows, and this reverts a tachyarrhythmia to a normal rhythm, sinus rhythm. And there are some diseases or like coronary artery disease or even dilated cardiomyopathy where the heart function goes less than 35%. So if the heart function goes less than 35%, chances of having arrhythmia and death is more. And in these patients, even without having an episode of VT, as a primary prevention, we go for an AICD. So that is what we need to aware people about, a machine which gives you protection for certain cardiac death if you have a substrate like heart dysfunction or a past myocardial infarction and heart function is less. And obviously for those who have a previous history of VT, history of syncope, then definitely it is a secondary prevention. We all can appreciate that it is absolutely necessary.
So AICD is required to be put in a patient who had a angiography, who had a coronary artery disease, who had angioplasty done and low EF. But, and also in those cases who had a syncope or who had a earlier cardiac arrest because of coronary artery disease, they also need AICD. Is that true?
Yeah, secondary prevention, if we have seen patient has a VT or a recurrent aborted sudden cardiac death with a low ejection fraction, in these patients we go for an AICD.
And what about the age? Suppose somebody has coronary artery disease, somebody had a angioplasty done, somebody had a cardiac arrest revived, then what is the right age for them to get to AICD? Younger or older, or which age group?
Depends when they are getting symptoms. A young patient develops a VT episode, he is qualified for a AICD. If there is no reversible factor, which is, which could be digged out, this is the reason why VT happened. We can remove it and the patient will not have VT. So unknown reasons, aborted sudden cardiac death, when the patient has, we can go irrespective of the age. So obviously the CAD happens in patients who are more than 50 years, 60 years. So the chances of having AICD is more there. But diseases like HCM, hypertrophic cardiomyopathy, which happens in young persons, where we go for an AICD if the patient has a syncope or a bad family history.
Fantastic. Thank you very much. Dr. Dilip, so if I understand correctly, as you explained, that KK had an underlying disease, and obviously it was expressing itself, not as a classical heart attack, but it was a kind of non-classical heart problem, which probably got ignored, and it got precipitated by the exhaustion and whatever happened in that 2 hours when he was in that hall. So even if he was not in the hall, could he have still died, or could he have still had a problem?
Definitely, sir. He could have. There's one truth is there. He had a heart problem. He had a heart attack because apparently, with what I got the news, and I heard about that he had spoken to his wife, and he told about something about shoulder pains and hand pains and some, he was taking antacids. So it was very clear-cut signs of a heart attack, and he could have died even if he was taking rest, if he had not come to hospital, because arrhythmias can happen any moment, and we can't predict arrhythmia. So the only way in this situation is to reach hospital just to get checked and things to be clarified out. So,
I can reasonably guess and say that if we had taken him to the hospital straight, rather than going to the hotel and again wasting time, probably situation could be different. So nobody can, it's just a hindsight is always 6 by 6. So in retrospective, we can say that, but then such is life, such is destiny. So friends, it's very clear that your destiny is in your hand. You please identify such symptoms. If you are having it, don't hesitate. Don't be scared that what will happen if it turns out to be a heart problem. If it turns out to be a heart problem, you are lucky that it got diagnosed early. Diagnosing early is paramount, especially in a killer situation like heart attack. Heart attacks directly kills. Sudden cardiac death happens because of 1 or 2 places only. One of them is the heart. The majority is heart. As Dr. Dilip Kumar has said that 17.3 million people die because of cardiac death So that is a 1.7 crore people die, and 10% live in this country. That means 17 lakh people die every year in this country. So it's a huge, that means 1 lakh plus people die every month. That means 3,000 people die every day. So you understand the enormity of it. It's something which can be prevented by being careful, by get your test done in time, and by getting your checkup. And in case something happens to you, you feel it, come to the hospital. A simple ECG will save a life. Simple, plain ECG will save a life. And with the new gadgets available where they can check your ECG on your smartphone, don't forget that technology is going to be a great enabler. If that is available, take it. I think with this, I must thank Dr. Aviral Roy for beautifully summing it up in the beginning and providing the background and giving those problems which must be watched by you regularly. And of course, Dr. Dilip Kumar, our senior consultant cardiologist, for telling us very lucidly that what is required to stay healthy, what is required to keep your heart ticking. All the best, best of luck. Do remember us for anything. And I will record this episode and send it to you. Please share with your friends. This is a very important information. You might save a life. As we are trying to do it, please join us in taking this knowledge to every loved one you have with you. Thank you. Namaskar. Have a nice weekend. Thank you, Dr. Dilip Kumar. Thank you, Dr. Aviral Roy. Thank you, Rotary Club of Calcutta, Abhiana, and Bengal Chamber of Commerce for joining us and helping us in spreading the knowledge. Thank you very much. Namaskar.
Thank you, everyone.
Thank you.